Greetings and welcome to another exciting episode of Tuft Talk with Zach Monroe and Andrew Card. We got an exciting episode. How are you guys doing?
Doing good, Will.
Doing pretty good.
So we set up our gear here for our next episode, and Andrew was already complaining about his ankle from soccer.
Yeah, I mean, after my 2 goal scoring performance, led our team to victory.
Oh,
that's true.
That was very nonchalant.
That was
2 goal
that was
scoring.
two.
I sacrificed for the team, so
What happened? You couldn't make it for the hat trick? Didn't want to?
I had 2 goals in about 1 minute,
Yeah.
and then didn't score the rest of the game. But
Yeah.
Well, Will Trohanis does not need an introduction. Here he is. And we also have Austin Jett today. So thank you guys for joining us in on this great, exciting episode. I'm sure we're going to cover a lot of good topics, some stuff that Zach and I are not expert on, but that's why we brought you in.
By any means.
So welcome.
Yeah,
Thanks for
welcome.
having us.
Yeah, definitely. Thank you.
Exciting to get some guests on here. Last episode was a little Q&A, and it was just Will and I, and Will Card and I. We must clarify on this episode. And so some fresh faces, good for the audience. So, yeah, welcome. So let's just start off a little brief introduction of both of you. Austin, if you want to start first for us, since you're our friend around CMC, been one of our strategic partners on our benefits side. So go ahead, bud.
Absolutely. Thank you. So I'm Austin Jett. I'm a senior partner with the Baldwin Group, an insurance brokerage agency based out of Florida. We've got a big presence here in the Chattanooga area and East Tennessee. And as Zach mentioned, I have had the pleasure of working with Card-Monroe on their employee benefits programs, designing it, rolling it out, tweaking it, implementing different solutions over the last several years, and really enjoyed the partnership with you guys. And thank you for having me on.
And the other Will.
All right. Will Trohanis. I'm Chief Revenue Officer for a company called One-to-One Health. So we help employers manage their health benefits, and we take care of employees and their families. So trying to make it much more easy for people to access care that they need on their terms. And so have had the privilege to go way back with Austin.
That's right.
Almost 20 years.
Yeah,
now?
it's getting there.
Whew, getting that old. But yeah, actually, I'm a Chattanooga native, started in the business at Unum and worked with Austin way back when. Great to be here.
So we were talking a little bit earlier about you hit on it as AI. And so I'm curious from where you all sit, how that's becoming more and more a part of the benefits perspective and or just healthcare in general. You know, I've heard from the doctor perspective how them utilizing it on their daily work is becoming more and more necessary, and it's going to improve our overall health because now you have this database of intelligence that'll help diagnose. So, I know you hear that from a doctoral perspective, but just from where you all sit, what are you seeing from a AI perspective?
I mean, it's everywhere in healthcare right now because it's a sector that's fraught with waste. And so I guess it makes sense that there are so many different corners of healthcare where AI is becoming prevalent. We made a decision as a company that anything that's patient facing, there would be no AI involved in that because we want it to be a human experience. Yeah. And if you've ever used one of those like AI symptom checkers, like you can go down all kinds of rabbit holes and be like, oh my gosh, like I'm real, there's something really bad,
The original WebMD diagnosis.
That leads into
it's cancer.
Yeah. But I mean, what
leads to stage 4.
What is wild is there's over 1 billion health searches every day on Google. And I'm sure with ChatGPT, it's even more. 1 billion. Like that's crazy. And so, where we find applications for AI that have been helpful are, how can we use it to help support our providers so that they can operate more efficiently.
Sure.
So being able to summarize visit notes, we use it for our quality assurance and compliance checks. We have safety checks built into our conversations now, and all of that running through a walled off large language model that we feel like is really powerful. And one of the cool things we've done with TextCare, essentially we kind of have to wait for you to come to us. You come to us when you need something. But with all of the data that is out there now, we've been able to train models so that we can say, oh, these are the conditions that we need to go after with this population, or you really need to focus on diabetes with this group, or high blood pressure, and so that we can actually go out and bring some of those people in instead of just waiting on you to come to us.
Yeah, that's cool.
It's going to be interesting to see what AI does in the overall insurance and benefit space. I know AI is helping insurers be more accurate in how they underwrite health plans, right? So, I mean, they're quickly being able to sweep a lot of sources of information to get a read on an employee population. That doesn't necessarily help employers.
No, it doesn't. Yeah.
It'll be interesting to see, because I mean, we were talking about the Wild West earlier. I mean, we're in the Wild West of AI and healthcare. I mean, there's a million ideas out there, right? Like the new .com bubble is going to be go gamble on, AI-backed healthcare companies, right? I mean, it's just like, one will go to the moon, the next 10 will crash, whatever it is. But, things like genetic level therapies, AI will be able to bring, the computing power to be very prescriptive about what you need versus what I need. Yeah. I present with the same symptoms you present with, but our genetic makeup is totally different. And, getting down to that level, talk about like the genetic level of medicine and things like that, very prescriptive to people. You think about how that plays out in the pharmaceutical space. Could be very good, very effective drugs, probably also very expensive drugs, right? So a lot of money is going towards AI in healthcare right now. We'll see where it ends up. But, it's pretty much like so many things with AI right now, kind of any end result is imaginable. Who knows what it'll be?
Yeah.
So
one of the things that it's always interesting to hear some of our patients where they're like, oh my gosh, like I thought this was a bot, like you're a real person. And they're like, yeah, no, I'm a real person with a clinical degree to exercise judgment for what's wrong with you. Yeah.
That's the scary part. It's like it's getting to the point where it's getting hard to tell what's real, not real, and so it makes sense. But I think it's one of those sectors, like it's not going away. So like you all are doing, you have to embrace it in some form or fashion, and embracing it where it folds into your culture, it folds into your ethos of who you are and taking care of your customers, but also providing better services with just easier methods. I mean, who doesn't want that? And so, embracing that for every industry, globally, but especially in the healthcare industry, which, like you said, is wasteful, has so much data out there that can be mined and more accurately used, and
100%,
whatever it may be. I mean, we're having to look at AI here and how we use it and for our business. So it's exciting, and it's one of those in some industries you can look at it and it's kind of scary. I think I was having this discussion with one of my friends who's a lawyer about AI and just the whole legal side of it. It's a little scary for them, right? Yeah. Especially if you're not a specialized lawyer in some sector, whether it's patents or whatever it may be, IP. You're just a general lawyer. Like, and he's just like, man, we just have to embrace it. Like, we have to know it's there, embrace it, and use it to our advantage.
Yeah, legal work. You want to set up an LLC? No problem. You need operating agreements?
Yeah.
Oh, you need a logo for your company? Here's 10.
Yeah.
You don't like them? All right, here's 10 more.
Yeah.
Okay.
Within minutes, if not seconds.
Yeah.
Right. Here's a marketing video. We'll just give us a script and we plug it in.
Well, you think the person might have like 12 fingers or something like that.
Oh, that's normal.
For the most part, pretty good.
Their mouth may not be moving with the words, but it's close.
We've seen that before.
We'll give it 18 months though, right?
Yeah. No, that's right. Yeah, it's just getting better and better.
You think about though, like going, healthcare and the doctor relationship. So we have this sort of, the debates over what is AI going to do to our society. Are we all going to just be able to live lives full of joy, freedom, and abundance? Or is it going to be some draconian, there's no jobs left, and, it's Terminator 2, all over, whatever out there? The idealized notion is, it's going to help us be better at our jobs, help us be better people. Healthcare, like with TextCare, the doctor-patient relationship kind of has that easiest path towards that. As tools develop, helping them be better at their job.
Yeah.
I don't know. I'm not 25 years old, so I can't
You look
speak.
like it.
I'll
You're pretty good.
I can't speak as a 25-year-old, but I do have this idea that I hold to that most people still want the human relationship, the doctor-patient relationship. I'm not ready to outsource my health to bots completely.
Yeah.
I'm fine if that human who has discernment and intelligence and training uses these tools to be a better provider of healthcare for me, but I'm not ready to outsource that the way I am if I need to change my flight or I can't find my bag or whatever it is.
Right, because something a computer's never going to do is pick up on that emotional part of it.
Correct.
And sometimes somebody can say they have a pain, but if you're in front of a doctor or talking to a human, they can sense that pain versus a computer is just, this is what I'm programmed to do and this is the way to treat it. And it may not be the most, granted, it's pulling from everywhere, it's learning, it's going to have great effects, but there's also that emotional component where you need somebody that can empathize with that and make sure you're delivering the right result.
Yep.
I would like to, you mentioned something interesting I would like to go back to and get your thoughts on. Growing up, it's like when you hear people giving advice about when you're going into the workforce, it's like you want to get a good, stable job with good, stable benefits, a good benefit plan from your employer. What are you seeing, I guess, because I'm out of that age where I'm entering the workforce now, what are you seeing, I guess, maybe hearing from employers about what new recruits, people coming into the workforce are expecting out of them for their insurance? And also, I guess, piggybacking on that is how do you kind of collaborate with those employers and how do they tell the story and help those new employees realize how do they maximize their benefits?
It's a great question because when you think about a lot of those folks that are coming into the workforce now, I mean, they expect things fast. You expose them to our healthcare system as broken as it may be, like it's designed to serve all of the stakeholders that get a piece of that pie, and so it's interesting how they realize, hey, if we're going to keep a lot of these Gen Zers engaged in our company and excited by the benefits that we offer, it's got to look a little bit different. And so that's where we've found, I think, a good stride with product that we built called TextCare, which makes it's on-demand access to care. It makes it very easy to have someone that can help kind of navigate you through the healthcare system, but can take care of the whole household. And that's something that people love, just being able to have that fast, reliable, and it works like it should. Like you don't jump through the traditional hoops. And so that's one thing that I've been excited to see, that there's a lot more companies looking for things that really kind of fit the appetite of what that modern worker is coming in, other than looking for, more cash, tons of PTO, flexibility. Like the work from home thing is still like a big challenge for, I think, a lot of employers to wrestle with. How do you strike the right balance with that too? Yeah.
I think I'll add to that a little bit, and Will, I'd like you to talk a little bit more about sort of the moving parts of TextCare, but, the younger generation, they want to interact through their phone as much as possible, right? And that's just the reality of it. And that's TextCare checks that box, but that also translates up into the older generations as well. Everybody interacts through text, right? I mean, that's just it. It's like, I want ease. I want it to be simple. I want it to work well. And I want to be able to access it through my phone. So think about like the model of seeing a doctor. Okay, right now, I got to call the doctor's office, right? They're probably not going to answer. They call me back to get an appointment, right? The next appointment's 3 weeks from now. I've got to drive down to the whatever the doctor's tower outside of Memorial Hospital, go up to the 9th
That's
floor.
where mine is.
Well, there you go, right? Go up to the 9th or wherever it is, right?
Yeah.
Wait 3
Not
hours.
throwing shade on Memorial, right? Exactly. But then I go in, I got to wait an hour and a half. So I waited 3 weeks to get in. Then I wait another hour
Some
and a
good
half.
magazines maybe in there.
Good magazines,
Yeah.
great music, right? I'm sitting next to
Comfortable chairs.
I got a guy with strep throat to
Not
the
this
left,
comfortable.
a guy with COVID to the right. We're all sharing germs in this room where the air is recirculating. And then I go see my doctor for 6 or 8 minutes, right? It's a very involved process. It's not a very rewarding process. It's a very impersonal process. And I'm not saying every doctor is this way, but the model has moved that way. Hospitals have bought up a lot of the doctor groups, right? And the reason for that is, there's some profit in it, but it's a feeder system. If I can get you into my primary care model, I'm going to get you for the specialty cares. I'm going to get you for the imaging, and ultimately the surgeries and the places where we actually make some money, right? And so it's impersonal, it's inconvenient, it doesn't feel good, it doesn't feel rewarding, feels disjointed a lot of the time, not all of the time. And so, TextCare, and I'll sort of tee you up for this a little bit, they didn't invent telemedicine, but we've worked with all of the telemedicine providers out there, right? In my opinion, what TextCare did was they took everything good about telemedicine, they amplified it. They took everything annoying and bad about it, hindrances to care, and they discarded it, right? So some of the big name telemedicine providers out there, okay, I'm a broker. I educate your employees. I come to the open enrollment meetings, remind them that they have, insert big brand name telemedicine provider here. It's in there, it's in your benefit guide, and they're nodding along. Unless I do it at the 32-minute mark of my speech where I've lost them 15 minutes before, right?
They're nodding for a different reason.
Right. All they heard was, my rates aren't going up this year. Cool.
Yeah.
Guilty as charged.
Right. Yeah, exactly. So, they forget about it. And then it's like, you get sick. It's like, oh, do I have that telemedicine? What do I have to do? I've got to download an app. I've got to set up my profile. I've got to request a consult. Now, with the big ones, you request a consult, they'll get back to you pretty quickly. Right? And I'm on the phone with a doctor I've never met who doesn't know anything about me. And I spend my 5 or 6 minutes with him or her talking about what's going on. Typically, they prescribe me one of everything it could be. I get a steroid, an antibiotic, maybe cough suppressant, whatever it is. Go pick them all up at Walgreens. And it can work well, right? But the utilization numbers we see on it are typically very low. And my opinion on that is because of the app-based barrier to it. I've got to download it, set up a profile. Man, I got a fever of 101. I forget about it.
If you even remember where your paperwork's at, that you got how to set
Go
it up.
What's that app
dig
called?
up an email.
And I can't tell you how many times my wife and I, it's like, I know we have that telemedicine, but we might as well just run to the docking box down the street. We'll pay the little bit extra, but at least we know we can get in there and get out.
Yep. And so, compare that to, okay, start the meeting off with, everybody pull out your phone. You've got this service called TextCare. We're about to tell you about it. Save this number in right now, right? TextCare, save it in. Every employer has a unique number that you simply text, just the way you talk to everybody else in your family and all your friends. 98% of the time you text it, they get back to you. Talk a little bit more about the process to use it.
I'll start with just a couple of things you were talking about earlier, though. With texting, it is the most, I know you guys operate all around the world. It is the most widely adopted form of communication in the world. Like, everybody is doing it. It's like the great neutralizer. Everybody does it. And so to meet people where they are in that medium, it just kind of makes sense. And so, I'll tell you a quick story, kind of how it all got started. We started in the on-site health business. So kind of opening up a primary care office at a company, putting our clinicians, just to see employees at the workplace. And a few years ago, we had a trucking company, and they were all over the country. And they said, we've got a couple hundred employees at our headquarters, but it's these drivers that are all over the country that go to the emergency room for stuff they shouldn't, but they don't have a primary care doctor. Can you take your on-site clinic model and get it in the hands of these drivers? And I'll never forget the head of HR, who's awesome, just shot straight from the hip. And she was like, she pointed at us and she said, if you bring me another app for these guys and gals to download, I'm throwing I don't know if you guys can bleep me out or not, but like, she was like, I'm throwing you out of this office. And so we're like, all right, how do we build a model that's radically easy for these folks to use? And so, Dr. Helton, who's our founder, he said, I've been giving my phone number to my patients for 25 years. Call me, text me when you need me, and I'll be there. And so we leaned into that just by making it a medium that's easy for people to use. And you were talking about the wait to get in. The average wait time now to get in to see a doctor is 29 days. And it's that's too long.
Yeah.
Especially when you feel like crap and you don't want to go
well and I'm sick again.
Yeah. And so a couple decisions that we made were, hey, we're going to let people, use whatever medium they want. They can text us, they can call, we can video chat. But we're going to actually not make it that transactional relationship like you were talking about. Kind of like when I go get an Uber to the airport, I might have a good driver, one time. But the one thing I know is I'm probably never going to see that driver ever again. And so you think about like the traditional telehealth world, it's like when you're talking about your health, I kind of want somebody that's in it with me and going to be able to make sure I get better. And so that's why we leaned into this approach of using our own clinicians, giving you somebody you can actually build a relationship with.
Yeah. And by the way, if somebody's listening and saying, well, not my doctor, I can get in with him anytime, that's not been my experience. Well, that may not be your experience, but if you need proof of the inability to get in with a doctor and form a relationship, you need to look no further than every street corner in America where an urgent care clinic is popping up.
Isn't it crazy how many are like in random places too?
Oh yeah.
And so I can pay $150 to go see somebody who doesn't know anything about me. They're firing up Google. We're trying to figure it out together here. It's
the original Google Doc.
Yeah. So let's tell me about your symptoms.
Yeah.
Let me pop them in here. And then it's just so the way they've done it. So from my standpoint, which is one of my primary jobs with my clients is managing the finances of the whole benefits picture. Their price is $10 or $12 depending per employee per month that covers the entire family for unlimited access to a designated care team for the employee population. So it's not a nameless, faceless doctor. It's the same team responding. And again, if somebody's listening saying that wouldn't work for my employees, I would challenge you to think twice about it. We see nothing but good experience. I'll share a couple of results with you. I put it in with a group, very similar size, very similar demographics to Card-Monroe over in Blairsville, Georgia. Almost to the nose, the same number of covered employees, right? Blue collar, good guys and girls, that's the population of employees, right? They're just not the most healthcare astute people out there. It just is what it is, right? And it's easy to get lost in the system. We put that in on 170 people plus family members for $10 per employee per month. And they used the service, that population of people used the service in the first 12 months, 732 times, unique times. So I used it back in January for some poison ivy. I went and got in a fight with a poison ivy vine in my yard. I can recognize the leaves of 3 from a mile off. The vines, I forgot about the monkey tail, and I interacted with them, including, a dermatologist trained provider that you have, because it started to look weird after a couple of days. I interacted with them 3 or 4 times. That would have been one of the 732. That's not 3 or 4. That's one of the 732 interactions. We put it in here at Card-Monroe, and, we were reviewing the data with the team, because it's renewal time, and we were going through all that. And I said, well, we've got 2 months worth of data. Let's take a look at it. So 1-to-1 guarantees that you will use it at least once per covered person, right? It's not going to be every single person's going to use it, but some will use it 2 or 3 times, and it will net out to once per covered person in that first year, or they will refund the difference back to you. 732 versus 170 at that other one. At that 2-month mark, you all were on pace, your employees, to use it to hit that metric of once per person by the 3-month mark, right? So this is for everybody. It really is. It's an easy go-to for me because it's, when you look at it against the overall benefits budget, it's a rounding error. It's 1 to 2% of an employer's spend to be able to positively affect their employees and their family members 75 to 80% of the time, because everything should start with primary care.
You're talking about going to the urgent care. That urgent care visit is $160. Yeah. And TextCare is less than that. Right. Covers the whole household, and we find the average member will use it 5 times throughout the year. I'm a frequent flyer. I've got 2 young kids that are just like absolute germ factories. And like, it's nice to be able to have, like, in the middle of the night when you've got a stomach bug or something else running through your house, to have somewhere that you can turn to and have that peace of mind. But what's really cool, like, a lot of people will start with the stuff that they'd go to an urgent care with, and they're like, all right, these people are really helpful. And they'll say, I haven't had my blood work done in a long time. Like, can you help me with that? And then we can actually get into some of the preventive health, like their long-term health. And like, that's the stuff that I think is so cool, because, you know, I'm sure this will come as no surprise. You've got an open line 24/7 with people that care about you. You see some interest there. There is some interesting stuff that comes through there. And it's interesting. A lot of our providers will say, well, you know, would you like to talk about this? Let's get into a phone call or a video chat. And there's something about text that makes people feel like they can speak a little bit more freely about what's going on. It's kind of like back in, you know, middle school, when you wouldn't feel comfortable telling a girl that you liked her, but like you'd pass her a note. Yeah. It's like, that's one of the things that we kind of equated
AOL
to.
Instant Messenger.
Yeah. It's like, you know, it gives a little bit more comfort in that dialogue.
No, I mean, you know,
Zach and I didn't have any girls to pass notes to.
That's the truth.
We can't relate.
You can say that again. But yeah, you know, you're referring to, obviously we adopted it here at Card-Monroe, and it was when you brought it to us as an option, it was like, for us, it was the easiest no-brainer whatsoever. I'm like, we immediately were like, yeah, go.
Well, the cost is just,
we didn't even have to like, oh, let's, you know, run the numbers on this. We're like, that's too easy. And I mean, you know, 40 years old now, so I'm not quite with the younger generation, but still young at times.
You're almost to the other side of the hill.
Yeah, thanks, Will. But you know, I sometimes fly a lot. So like Delta has where you can message them, and I sometimes like, I'll just message them. It's easier than trying to, you know, get queued up on a phone. So I'll just message them, and then it's like, you know, you feel like it's on your timetable. Then like I can kind of write them back as I'm ready, as opposed to just sitting on with the phone on hold. Yeah, you know,
every Card-Monroe employee and their family members are tethered to their care team 24/7, 365 at their convenience. You know, so.
And one thing I was going to say too that you guys both touched on is how it covers the entire household. It's not just the employee employed by the company. And from personal experience, I can say that is a really awesome thing for new parents. You know, the stereotype of new parents is every bump, bruise, nick or cut or sneeze that their baby has, they're all worried about it. Oh, what is this? What is that?
Right.
And I have 2 girls under 3 myself, and my wife and I use it all the time. Of, you know, our daughter wakes up in the morning, she's got, you know, something on her eye. Before we'd be like, do we really need to take her in for that? But now it's just immediately we text TextCare, send them a picture, say, hey, this might be this is this. I'm going to prescribe you this. Go and pick it up in a couple hours. And within, you know, 5 minutes of waking our daughter up in the morning, seeing there's an issue, we've got what we think is an answer. We've got a prescription getting made ready for us.
Right. And
it's just such an awesome thing, I think, especially for new parents, to have that immediate line of help if you need it.
Well, and just remember, in about 10 years, our providers are also trained in mental health in case you need that.
That's the truth.
I got 2 daughters too, and I'm like, oh man, once they become teenagers, I'm gonna need a lot. So,
and if you have
I appreciate you sharing that.
If you have a third, it's all good too, because those are like your toughest ones, because you just get over the point of like, you'll be all right.
Get back in there.
Yeah.
I just specified new parents there.
Yeah, you did. You clarified.
It's probably worth mentioning on TextCare one thing. So it starts with a text.
That's
like,
what
you can go to
ask.
audio. You can go to video, right? It's not just like, I mean, there comes a point where you need to talk to them. The interaction starts with text. From there, do I need to go to audio? Do I need to go to video? Yep. And, you know, kind of going back to the finances a little bit. Again, anybody who's listening, who's managing a benefits plan, who owns a company, who's in the ownership structure of a company, this line item's big. It's getting bigger. It's a problem. You know it and I know it. You know, so anything like this, TextCare, going back to your question of what's new and exciting out there. This is one thing. What employers need to be looking at is something like this program. It catches things earlier and it keeps claims off the book. If you're fully insured, meaning you're just buying a Blue Cross insurance policy or whatever the case may be, the number one formula is numerator over denominator, right? What did we pay out in claims over a year? What did we receive in premiums, right? That's what dictates what my renewal is going to be. If I'm a self-insured employer, a claim that never occurs is a claim that I never paid for, right? So it's a much more direct correlation to savings or controlling cost. Every bit of this sits outside of the health plan, right? So 732 visits on that client with 170 employees. Now, I'm not going to say all 732 would have materialized. A portion of them, they would have just kept coming to work sick, right? And that's not good either.
Right.
But that's a lot of doctor's visits that never became a claim. And that's just on, avoidance of things. Now you start thinking about prescription drugs. Let's try cheaper alternatives. Let's try more baseline drugs before we get aggressive with more expensive drugs. Nobody's saying don't get there if that's what's needed, but let's make darn sure that's what's needed. Or the person who says, because this is so easy, I'm going to talk about some lower right quadrant pain I've been having, whatever the case may be. And it becomes, you need to see a specialist. We can help get you in. Will can talk about that, through models like this. And you may catch something that's treatable that in 2-3 years might not have been treatable, might have been treated for a few $1,000s instead of several $100,000. Those are harder to quantify, unless you just have a whole lot of employees. But anything you're doing to keep claims off the books is good. Anything you're doing to keep claims off the books while improving employees' experience, that's as good as it gets.
Yeah, you hit on it. I mean, it's not just a text or even a phone call. Like we talked about prescriptions, but Austin, you've alluded to before, like if it's an imaging or something like that's needed, they can take it as far as getting that worked through, correct?
Yep, totally. So there's a dedicated care coordinator that's a part of your care team. So they can help with those referrals and making sure that it's someone that is in network and being able to take that off your plate, because that's part of the burden too. It's
you're right.
How do I even start? And so having somebody that can help take that off your plate is
they're helpful. It seems like one work requirement for front desk at a doctor's office is not helpful, right? So I mean, it's just
no personality and not helpful.
It's not warm and fuzzy. These guys will take it, but let's direct you where you need to go and let's help you get there.
All right. Well, so, we've talked got a great conversation, but what if someone wants to reach out to either one of you for either benefits or more questions about TextCare? How can they get a hold of the both of you?
Well, you can reach me, email austin.jett@baldwin.com. I can be reached on my mobile, 423-290-1260. TextCare is probably more interesting, so you can just go ahead and call me with that as well, and I'll get it to Will if it's appropriate.
You'll get them over to me, right?
Yeah, that's right. I'm kidding.
My email address is wt@textcare.com, and happy to answer any questions or anything that anybody needs. But y'all, this was a lot of fun. Thanks for having us.
Thanks for having us.
For those that are driving and can't write those email addresses down, I'll include them in the description. So when you get home, go to your description area. I'll have those links there if you want to contact these guys.
Thank you all for tuning in. Just as a heads up, we're going to come next month with one more episode to wrap up season 1, and then we'll take a few months break and we'll be back with season 2. But appreciate you all joining us for this episode, and our one episode to come. Please be looking out for that. And if you haven't already, like and subscribe, and Will.
Always got to hit the noti bell.
Hit the noti bell. See you next time.